We're talking with Dr. Meredith Overholt, board-certified dermatologist, and we're going to be talking about creepy crawlies, and I can't wait. Meredith, welcome to the Dr. Bob Show.
Thanks.
What is scabies?
Well, scabies is the human mite, okay? So this is an organism that can not only bite a human, but actually burrow into the skin, lay their eggs, and live in a person. They don't just bite and drop off.
Like a little gopher? They have a little gopher hole under the skin?
That's essentially it.
What is this called the itch?
Some people call it the itch, and actually it's the 7-year itch because it actually used to occur in epidemics every 7 years, so that's where that term actually comes from. But of course, when you start treating a disease, then the natural epidemic of it goes away.
And is there something characteristic about the itch of scabies?
Absolutely, and that's nighttime itching. Many people will say that it's much worse at night than during the day, and that is when the organisms are more active, so they're feeling it.
So that's the reason.
That's the itch. And but it is surprising how many times there will be somebody in the family who is affected and really doesn't itch that much. So itch is not absolutely necessary to the diagnosis. Some people just aren't bothered that much by it.
Does scabies cause a rash?
Absolutely.
What's the rash look like?
Well, the typical rash, if it's a child over about 6 months old to adulthood, you very rarely see anything above the jawline. So it doesn't really seem to affect the face or scalp, okay? The favorite locations are around the fingers, oftentimes in the webs of the fingers. Wrists are popular. Lower abdomen area is popular. So any of those, and they just look like little bites.
How about the buttocks?
Yes, absolutely.
When people say they have a rash on their buttocks, it pretty much excludes a lot of things it could be, because so I go right away to thinking about what time of day does it itch the most?
Absolutely, and anybody in your family that's also itching.
Is there a characteristic rash other than between the fingers? What it looks like? Is there look like poison ivy at all?
Well, the not so blistery, more like little bites. More of like a mosquito bite type, but it's usually a little bit smaller, and just multiple typically.
So what makes you suspicious that it might be scabies?
Well, again, that if there's a history of a contact that's also itching, and then the nighttime itching are key, and then the bite-like presentation with the right locations, and then we always do a scabies prep, which is to take a little blade and scrape the surface of one of the burrows if you can find one, or even some of the bumps, and look under the microscope, and you can oftentimes see the mite itself.
So you can see little creepy crawlies under the microscope.
You can. If you do a mineral oil prep, you can actually see them move. And you can also diagnose it by the presence of the egg, because you can see those under the microscope as well.
What is the treatment and how effective?
Well, certainly still the main one is Elamite, and that's a topical application. It's ovicidal, which means it will kill eggs, so it really only has to be done once, but it should be done by everyone in the household.
Everybody in the whole family?
Even if they're not itching.
Oh,
okay?
Oh my goodness.
And so we do everybody
at once.
Lotion?
It's
a kind of a lotion, and you go from the jawline down over every surface. And it's still pretty effective in the United States, but there is a little bit of resistance developing to it.
And so if you've got resistance, is there some new medication?
There is a new medication. It's not really a new medication. It's actually an old medication, but it used to be used to deworm sheep, believe it or not. It's ivermectin, and ivermectin or stromectol is actually FDA approved for the treatment of 2 other parasitic diseases, strongyloidiasis and river blindness, which are not really seen in the United States, but we do have the ability to have that drug available.
Now, what do you have to do as far as the sheets and the bedding and the clothing and all that sort of stuff? Do you have to wash everything in the whole house?
It's a bit of a pain. The couches and carpeting are not usually a big problem, but certainly the sheets and towels. So what we usually tell people to do is get up, is put the medication on at night. You sleep in it. Get up in the morning, strip your sheets, throw them in a hot washer and a hot dryer. You take a shower, and everything that's touched you after the 8 hours, like the clean towel you used after the shower, is fine. I don't usually have them wash tremendous amount of clothing. If they can take what they've worn the last few days and put it in a black plastic garbage bag and leave it about a week, that usually does the trick. So it's not too hard of a process to get through.
How do people catch scabies?
Well, it is mainly by skin-to-skin contact, and so, you know, it does have the reputation of sometimes being a sexually transmitted disease, and it certainly can be, but close contact, kids at school.
Shaking hands?
Sure, I mean, potentially, you know, and then wearing somebody else's clothing or going to visit a friend and sleeping in a bed there, that sort of thing.
Meredith, let's go to bed bugs. They're a hot topic. You said, tell me about bed bugs.
Well, typically they're not found but in subtropical and tropical climates. But these days, with the amount of travel that's done, there have been some focuses of infection in the United States. Travelers will bring them in and they will infect the bed in hotels, and you can certainly get them.
Something typical about the bedbug bite?
Well, they are an insect, so they do bite and drop off. It's not a burrow situation. They do look like bites, bright red bites, and the classic is 3 bites in a row, so they call that breakfast, lunch, and dinner. Okay? And they do seem to bite a little bit in that way, and they will again drop off and infect the bedding. It's possible, though, if you wear a pair of pajamas in a hotel, I mean, if there's a lot of infestation, they can climb into the seams of your clothing, go into your suitcase,
go home,
infect the rest of your clothing, and go on home. So they do look like a small, people think that they're invisible, but they are not. They're clearly visible.
Little bugs that are crawling around. And what is the treatment for them?
Well, again, you're not having to actually kill the insects themselves on the person. So if the bite has caused a pretty impressive looking reaction, almost like a mosquito bite would, you know, if there are a lot of them and they're very, very uncomfortable, you can use a topical or even oral steroids to help calm the inflammation, antihistamines, this sort of thing for itching, lotions for itching.
How do you get rid of the bed bugs?
Well, that's the harder thing. You know, if you know that, you know, you need to strip the sheets, look at the bed, look along especially the seams.
Okay.
But heat is excellent for it. So using a hot blow dryer will often kill them.
Are there professional exterminators for bed
I would
bugs?
imagine so, sure. You know, they are able to be exterminated by a lot of different insecticides, and in fact some of the insecticides that we've gotten rid of because they were used to treat roaches, etc., and got into the water stream, were killing birds and that sort of thing, we're actually probably keeping the bed bugs away. So that's part of the reason we're seeing the resurgence.
Head lice. What is head lice, and tell me about that?
It's just been a persistent problem, and unfortunately the traditional commonplace treatments, which are over-the-counter, Nix and Rid, have gotten to where they are much less successful at eradicating this. So
how do you know if you've got head lice?
Oh, that's a pretty easy diagnosis.
Is it really?
Very itchy scalp.
Well, now my scalp gets itchy sometimes.
Sure, you're right, and some people will have flaky, itchy scalps, but the key is that the nit, which is a little white, hard substance, they're usually within about an inch of the scalp, and you can't slide them off. They are concreted to the hair.
What is a nit? I mean, what is it?
Well, it's the egg sac.
So it's the egg sac of the lice that's causing the problem.
Right.
Do they give symptoms? Can you feel the bugs crawling in the hair?
You can, and then again, even the treatments that will kill the lice often don't kill the eggs, so they have to be repeated, and you have to actually go through and remove the nits. But it can be a very difficult problem. It does involve a lot of cleaning of sheets and towels and clothing and that sort of thing, and can really infest a family or a classroom and just make for a very tough situation. Nursing homes, institutions have terrible problems with this.
Wow.
But there are some new options. There's a new benzyl alcohol lotion that's available. It's called Eulefsia. It's thought to be very, very safe, and that the likelihood of resistance developing to it is very low, but it doesn't really have a very high cure rate. Malathion, which, believe it or not, is the pesticide many people
Yeah,
are aware
yeah.
of from use in their yards, also can be used. It's called ovide lotion, and it can be applied very successfully. There's no resistance in the United States.
So you apply it to the hair. Is there any pills that go up to the head and kill the bugs?
Well, once again, that ivermectin that we mentioned
Yeah.
last time with scabies, the scabies and lice organisms are similar enough that they're both are able to be treated with that, and so we may see that coming in more and more to the United States.
So there is treatment available. We've got one more minute. Let's talk about swimmer's itch.
Well,
Tell
I
me-
brought this up because I saw several cases last summer in my office from one of the lakes here in East Tennessee. And this is a little parasitic organism, and it has a interesting life cycle where it's usually in a bird and then excreted in his feces, and it infects a snail, and then it gets in the water again, and it bites exposed areas of the skin. So a lot of people call it wader's itch because it likes those lower extremities, but any place where a bathing suit is not. Bright red bumps, usually occurring within 24 hours of having been in fresh water.
Itch like mad?
Itch like mad. It's pretty impressive looking. It's
How do you-
important to towel dry off after you get out. For some reason, that seems to dislodge them and get them to go away. But that once your skin is dry, they do die or leave, so they don't stay on you. Again, it's a bite and drop off situation.
So you don't have to treat it other than symptomatic.
Right.
So if somebody has, I guess you treat it with hydrocortisone cream?
Cortisone creams, again, systemic steroids if it's really bad.
Lots of creepy crawlies, aren't there?
Plenty more than that,
Yeah,
yes.
it makes dermatology very exciting with all the other things you all do. It's a wonderful field, Meredith, and thank you so much for coming to the Dr. Bob Show. I don't know if I'm going to be itching tonight or not, but I hope I don't get scabies or head lice or swimmer's itch when I'm
very
at the
fun.
lake.
Thanks.
Thanks for your help.
Okay.